Hello all together, I'm Micha Maeder from Gallen. I would like to summarize our hemodynamic study in patients with aortic stenosis. The study is summarized on one slide with a table and one figure. In the pulmonary hypertension literature, the mean pulmonary artery wedge pressure and the left ventricular end-diastolic pressure are often regarded as interchangeable, and it is stated that in case of a doubtful wedge pressure you should measure the LVEDP. However, there is increasing evidence that the mean wedge pressure and the LVEDP may differ considerably, and that this may be clinically relevant. In the present study, we measured the mean wedge pressure and the LVEDP in a near simultaneous manner in 335 patients with severe aortic stenosis, subsequently undergoing surgical or transcatheter aortic valve replacement. Overall, the mean wedge pressure was lower than the LVEDP, 16 versus 21 millimeters of mercury, and this was statistically highly significant. The mean delta between the two pressures was -5. In 88 patients, the mean wedge pressure was higher than or equal to the LVEDP. The delta was more or equal to 0. And in 247 patients, the mean wedge was lower than the LVEDP. The delta was less than 0. As you can see in the table and as summarized in the text, the patients with a positive delta or a delta of 0 had more severe aortic stenosis, worse ejection fraction, large left atria, more severe mitral regurgitation, more often atrial fibrillation, had a higher mean pulmonary pressure and a higher pulmonary vascular resistance, as well as a lower stroke volume index. As shown in the figure, the patients with a positive delta or a delta of 0 had significantly worse mortality after aortic valve replacement compared to those with a delta of less than 0. This was also the case when using the delta as a continuous variable. Every increase in the delta by 1 millimeter of mercury was associated with a 10% higher risk of death. The mean wedge pressure, but not the LVEDP, also predicted mortality. But when comparing the errors in the curve for mortality prediction, it was numerically higher for delta than for the wedge pressure. In summary, a constellation of a mean wedge pressure which is equal or higher than the LVEDP characterizes patients with more severe aortic stenosis, more advanced cardiac dysfunction, a worse hemodynamic profile, and worse long-term prognosis after AVR. Thus, the relationship between the mean wedge pressure and the LVEDP is clinically meaningful in severe aortic stenosis, and these two pressures cannot be looked as interchangeable anymore. Thank you for your attention.